Ladies and gentlemen, please join me in welcoming the Honorable Mark Holland.
Thank you so much, Dr. Black. It is a wonderful privilege to be here. Let me really thank the incoming president, Dr. Callback, and let me thank Dr. Carr, who Fran and I met in Ottawa a couple of weeks ago and was talking about this conference and said, really like to have you here. And so here I am. So hopefully you're excited to have me here. I'm very excited to be here. And on your birthday, no less, celebrating 80 years of serving Canadians in such a critically important time, now especially. We talk about the challenge that we're seeing across the world, where sexual and reproductive health and the rights of women are under attack. And a lot of the things that we thought we could take for granted, that were hard-fought victories, being challenged or rolled back. And so it's a time where we can't be complacent. We're called to move more firmly forward. So I'm excited to talk about that today. And there's a lot of things that we're doing in the realm of health. I could talk about the 26 agreements that we've signed with provinces and territories around primary care and the $200 billion that we're going to be putting in. I could talk about the Sexual and Reproductive Health Fund and the work that's going on there. And I want to thank the SOGC for their partnership, actually a very important project on providing information that we're working directly on. I just made an announcement on health data, but I'm not here to talk about any of that today. I'm here to talk about sex, to be very blunt, and the shame that we have around it. And we just had a conversation earlier, and if we as leaders have shame in talking about sex, then what does that say to somebody who has a sexual health issue? What does that say to somebody who's struggling with their sexual identity or with their gender? So we really have to change how we talk about sex and have mature conversations around sex and sexuality in this country. And so a lot of times I get asked, because we have pharmacare legislation, it's incredibly important, and why diabetes and why contraceptives? So diabetes is a whole other conference. It's a whole other thing. I'm going to talk to you about why I think diabetes is important. I don't think I have to convince you in this room why it's so important that we do contraceptive, free universal contraceptives across the country. But I'm going to give you access a little bit to what my thinking is and what I hope it accomplishes. Because in the first order, making sure that women have access to the contraceptive medicines that they need is just fundamental from a perspective of access. So we can take situations where a young girl, as an example, is in a household, maybe that household has insurance, but she doesn't want to have a conversation with her family about her sexual and reproductive health. Maybe she's in a situation where she can't have that conversation. Or what about somebody who's in an abusive relationship? I've talked to too many people about a circumstance where the partner has insurance, but they guard that in a controlling and abusive way, so that the woman doesn't have the ability to get access to that insurance to get the coverage that she needs. And then there's just the simple fact that cost is an extraordinary barrier. We know that oral contraceptives have a failure rate of about 9%, and IUDs a failure rate of only 0.2%. So that somebody who doesn't have enough money is forced to choose an option where there's a much higher rate of failure. But in the second order, it's really about freedom and autonomy. I think it's a declaration as a society that free and universal contraception means that we prioritize the sexual health and well-being of women in our country. I also think it means that you give real choice to women. We talk about, the 40% of pregnancies in this country being unintended. Somebody in the House of Commons said, well, you're going to depopulate the country if you do this. Look, if you want somebody to have a baby, okay, you give them choice. And frankly, if you want them to have babies, you let them choose when and if they start their families. That's not just a matter of social justice. It's not just a matter of it being right. But frankly, if you want to have healthy families, it's the right thing to do. And frankly, we have to change the nomenclature. I'm sick and tired of people dictating what family values are. Family values is not crossing our fingers and hoping somebody gets pregnant. Family values are about giving women the freedom of choice of when they start their family or if they start their family. And I think on that point, if you really are interested in incentivizing women to start a family, then making sure they have access to affordable childcare, making sure that there's a child benefit that's going to make sure they have the dollars to be able to feed that family, making sure that you're taking action on climate so that their child is going to grow up in a safe and secure world, making sure that you put the priorities of being a family first. Because what we're seeing all too often is people say, I'm anti-abortion. Okay, you're against choice. But then how could you also be against free contraception? And if you're against abortion, if you're anti-choice, and you're against access to free contraception, and you're against sex education, then frankly, you're against a woman having any control over her body at all. And I think we need to call that out. Why is somebody who is opposed to choice opposed to contraception? And that brings me back, I think, to my point about conversation of sexual health. Because I think that the issues of attacking the rights of transgendered people, the attacking LGBTQ rights, of being against universal contraception, what do all of these things have in common? Sex. And there's a thought that, you know, we shouldn't touch this topic. People don't want to talk about it. I was the first health minister, or probably the first member of parliament, who talked about the importance of pleasure in sex. And I'll just give you an example of why I think that's such a big deal. Afterwards, somebody saw the speech and they said to me, yeah, but that's like the first, few years of a relationship, and then that goes away, and then that's not important anymore. That's because we're not having conversations. This is a progressive, a super impressive person. But what does it mean if sex isn't affirming of who you are and isn't pleasurable, if you don't have that as a family value? It means you're susceptible to manipulation. It means that abuse can take place and you don't even necessarily know that it's abuse. I was in a sexual health clinic in Ottawa, and I met a young man named Kirk who was riddled with shame around his sexuality. This is somebody who had only ever engaged in consensual relationships with adults, and yet his life had been just ravaged with shame. And as a result, he hadn't got tested, didn't know that he had AIDS. Kirk finally found a way in to a sexual health clinic with a community of people who saw him as he was and loved him, and now blows you away as a beaming light, somebody who's now getting the medication that he needs, and is becoming an extraordinary advocate. And I think it's worth asking the question for people to take time to see who's working in the area of sexual health. People for very little money, who are there because they see that work lifts people up, lifts them out of darkness, gives them good. To see how much pain is in our society because of simply who somebody is. For me, the idea that we are taught not to trust our bodies and our feelings, to have shame about consensual relationships, has got to end. And it's a conversation I think is long overdue. Folks, sex isn't the enemy. Shame is. Sex isn't bad. Bad is bad. Sex should be about connection and intimacy and joy and pleasure. When it's about pain and violence, it was never about sex, it's about control. And when we don't have those conversations, those lines get blurred and bad things happen. And I think in the shadows of that, terrible things occur. I think if we have open, honest conversations about sex, about our sexuality, it's not only important for, when we talk about LGBTQ rights, but I wonder how much of us wear a mask, where we're afraid to talk about what's going on inside of us. How many people don't come forward and talk to a sexual health expert about issues that are going on with them, about what cost it has to our society and why? Because we're embarrassed about our bodies, because we're ashamed to talk about sex. 99.99% of the sex we will have has nothing to do with babies, and it's time we grow up about it. I look forward to working with you on it, and thank you for the opportunity to be with you here today.